Hi, I'm Ryan Robertson, one of the orthopedic surgeons and hip and knee reconstruction specialists at Ortho Virginia. I do all of the major joint replacements for the lower extremity, focusing on hip replacements, partial hip replacements, knee replacements, partial knee replacements, and then other advanced trauma reconstructions of those areas. Hip and knee pain can have many causes. Most commonly, about 70 million people are affected by arthritis, 30 million of those being osteoarthritis. And so whenever you're having those, going in to seeing a physician to be evaluated for hip pain could reveal that you have arthritis. If you have arthritis, there's obviously multiple methods to manage that. There are both conservative and surgical managements. And if you come in to see a provider, they can help you to go through that process determining when is the right time to move forward with surgery. In my hands, I feel that the right time to move forward with surgery is when you have x-ray confirmed arthritis, but you have started to give up activities of daily living or things that you like to do on a regular basis, and that's when surgery can be a good help to facilitate a better quality of life. Knee replacement overall is a very successful surgery, but there are certain patients that a total knee replacement is not the ideal procedure because they only have a partial aspect or one part of the knee that has disease. The other two are still relatively normal, and so they can be an ideal candidate for a partial knee replacement. The benefits of a partial knee replacement is it is a smaller surgery, usually through a smaller incision, which is less invasive, so slightly less traumatic to the patient, which then inherently leads to a quicker recovery. It also functionally gives them a better outcome to some degree in that you have left all of the ligaments intact, as well as two of the other areas of the knee are still intact so that it feels much more like a normal knee. And a lot of patients, if they are appropriate for it, have a very good outcome from it. Partial knee replacements are a good answer for the highly functional patient who still has good range of motion and is very active, but yet has knee pain and has confirmed arthritis in a single component of their knee. So as instead of doing a total knee replacement where we have to replace all the compartments of the knee, we can replace just the part that has arthritis to help minimize their pain but continue to give them a high functional status after surgery. So a partial knee replacement is an outpatient procedure. They are greeted in the preoperative area just like a normal total knee, but surgery lasts anywhere from 45 minutes to an hour and a half, and then they recover in our recovery area, get up walking around with our therapist, and then are able to go home the same day. They usually do recover a little bit quicker because it's a little bit less invasive than a total knee replacement. You're able to be walking immediately the same day of surgery. In my practice, I've chosen to align myself with Parham doctors for the care of my joint replacements, as they are a center of excellence in the care for joint replacement, and the team here is able to give a comprehensive care to the patient that allows for optimal outcomes from my surgery.